Hello, my dear. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. The topic of my lecture today about antenatal fetal well-being test. First of all, I should announce that there is difference between antenatal fetal well-being tests and intranatal fetal well-being tests. Okay? Okay. So what we want to discuss today, the aim of fetal well-being test, different tools used for fetal well-being tests like non-stress test, biophysical profile, evaluation of the fetal growth, obstetric Doppler ultrasound use, and fetal movement count. Okay, as you see, these 5 items included in antenatal fetal well-being test. While during labor, or what's called intranatal fetal well-being test, including fetal heart rate monitoring with CTG and biophysical profile and the fetal pulse oximetry and fetal scalp pH. So this is as regard the intrapartum or intranatal fetal well-being test. But here we are talking about antenatal fetal well-being test, and the antenatal fetal well-being test including the 5 items: non-stress test, biophysical profile, evaluation of the fetal growth with ultrasound, obstetric Doppler ultrasound, and the fetal movement count. So, what is your aim for using a fetal well-being test? Assessment of fetal well-being is designed to identify fetus at risk for in utero death or asphyxia-mediated damage and affect expeditious and safe delivery. As we mentioned, we have 5 tests, as you can see in this slide: the non-stress test, the biophysical profile, the evaluation of the fetal growth, the obstetric Doppler ultrasound, and the fetal movement count. So let us start with the first item, which is prenatal non-stress test. As you see in this picture, what is non-stress test? There is fetal heart rate monitoring using 2 transducers, one for fetal heart rate monitoring and one for contraction and detection of the fetal movement, and the results are recorded on strip of paper, and this is the monitor recording the fetal heart rate. Okay, as you see here, we consider the non-stress positive if there is acceleration more than 15 beat per minute for more than 15 seconds, okay, twice during 20 minutes of the test. Okay, so if I found in the non-stress test 2 acceleration like this one, okay, within 20 minutes, each acceleration more than 15 beat per minute lasting for more than 15 seconds, this is called reactive non-stress test. Okay, is this the only item I see in non-stress test? No, I also see for check for variability, beat to beat variability, the basal fetal heart rate, as in this picture it is 140. Okay, also if there is any deceleration, descent of the fetal heart rate or decrease of fetal heart rate more than 15 beat per minute, lasting also more than 15 seconds. So if there is deceleration, whatever the type, also the beat to beat variability is important, and if it is decreased or absent. So many items I can check during non-stress test. So What is the definition of non-stress test? It is an assessment tool for evaluation of the fetal growth through the use of electric fetal monitors that continuously record the fetal heart rate. Okay? Okay. So, what is the principle beyond the non-stress test? The principle is there is acceleration with the fetal in the fetal heart with the fetal movement. Okay? So, the non-stress test recognize the coupling of fetal neurological status to cardiovascular reflex responses. Okay, when you can start use non-stress test, at which gestational age? It is better to be used after 32 weeks gestational age until term when indicated. Okay, so what is the problem in using non-stress test if gestational age is below 32 weeks? The diagnostic value varies and has high false positive rates due to immaturity of the fetal heart. Okay? Okay. So, what about non-stress test before 24 weeks? Is it has any rule? No, of course, has no rule because it is non-reactive in such age. Okay? Okay. So, to be valuable, non-stress test should be used from 32 weeks gestational age upward till full term. Okay? Okay. What are the indications? Many indications for using non-stress test during pregnancy for as a fetal well-being test, in cases of maternal diseases and obstetric complications, like what? Like hypertension disorder with pregnancy, preeclampsia, fetal growth restriction, diabetes mellitus. Patient has decreased fetal movement, post-term pregnancy, systemic lupus, antiphospholipid syndrome, alloimmunization and fetal hydrops. Cases with oligohydramnios, cholestasis of pregnancy, multiple pregnancies, renal disease with pregnancy, chronic liver disease with pregnancy, thyroid dysfunction. Okay, so all these are indications for using non-stress test. What about interpretation of the result? Okay, interpretation of the non-stress test follows a systematic approach, including what, as I mentioned before, the baseline fetal heart rate. Yes, as in this picture, it is 140. Beat to beat variability, as in this picture, in red one, red line, this is the beat to beat variability. Okay, this is very important. Presence of acceleration, as in this picture. Okay, deceleration, drop of the fetal heart rate, more than 15 beats per minute, lasting more than 15 seconds. Okay, and if there is any contractions. And as you see in this table, the variability categories can be reassuring or non-reassuring or abnormal. The reassuring beat-to-beat variability from 5 to 25 beats per minute. Okay, the difference between one beat to the other should be between the range 5 to 25. If it is lower than 5 or more than 25, it could be non-reassuring or abnormal. Okay? Okay. So, when to say a normal non-stress? This case has a normal non-stress. A normal non-stress result is one in which two or more acceleration peak at 15 beats per minute or more above the baseline, each one lasting 15 seconds or more and all occurring within 20 minutes. So What about the non-reactive non-stress? Is one that lacks sufficient fetal heart rate acceleration over 40 minutes. So you did non-stress test. You didn't find any acceleration. Okay? So you continue the test for another 20 minutes. Okay? Because the possibility of fetal sleep is present. Okay? So you continue for another 20 minutes. So if there is no acceleration, okay, happen, this is called non-reactive non-stress test. So what about the technique? First, before you start, measure the blood pressure of the patient. Then apply the transducer on the abdomen, one for fetal heart rate and the other for measuring the intra-abdominal pressure for uterine contraction and also for fetal movement detection. Okay? You are going to do the test during 20 minutes. Then you measure the fetal heart rate and assess the number and amplitude and duration of acceleration that usually correlate with fetal movement. And you will find the result either reactive or non-reactive, as I mentioned before. Is abnormal stress test is an ominous sign? Always an ominous sign? No, it is not always ominous and can occur with a sleeping fetus. Okay? So you should put this point in your mind. Okay, if a test is a non-reactive, fetal heart rate should be monitored for at least 40 minutes to account for the fetus sleep cycle. And you can use vibroacoustic stimulation. As in this picture, this tool is used for stimulation of the baby to move, to be more active. Okay, as you see in this picture, during non-stress test, we used the vibroacoustic stimulation to stimulate the baby to move and to shorten the length of non-stress test. What is the duration? The duration, as I mentioned, 20 minutes, can be extended to 40 minutes, and some believe that we can continue the test up to 60 minutes. But the recommendation of American College of Obstetricians and Gynecologists from 20 to 40 minutes. Okay? Okay. What about the continuous non-reactive non-stress test? It indicates central nervous system depression. But further evaluation is necessary, usually in the form of what? Biophysical profile or contraction stress test. So let us go to the biophysical profile. We did non-stress for for a woman, and we found non-reassuring or non-reactive. Then we are going to do the biophysical profile, another item of fetal well-being test. What is the biophysical profile? Biophysical profile include two categories. One, fetal heart rate monitoring as non-stress test, as I mentioned before, and the other one by ultrasound, detecting the amniotic fluid volume and detecting the fetal body movement, the fetal respiratory movement, the fetal tone, which include the one limb flexion and extension, or hand closure and the opening. Okay, so 5 items included in biophysical profile. One of them non-stress test, the other 4 related to ultrasound examination over 30 minutes. Over 30 minutes. First, we examine the amniotic fluid by measuring the deepest vertical single pocket, the largest one. If we divided the uterine cavity into 4 quadrants, we will measure the vertical diameter of the largest one in each quadrant. So the largest vertical diameter should be within the range 2 to 8 centimeter. If it is lower than that, this is abnormal. If it is more than that, this is abnormal. Okay. So single pocket, or using the amniotic fluid index, we divide the uterine cavity into 4 quadrants as I mentioned, and we will measure the maximum vertical amniotic fluid diameter pocket in each quadrant. So the sum of all quadrants should be between 5 to 20. If it is less than 5, it is abnormal. If it is more than 20 or 25, it is abnormal. Okay. So first we evaluate the amniotic fluid, either with single pocket or amniotic fluid index. Then we are going to evaluate the fetal breathing movement. Fetal breathing movement, at least one breathing movement during the 30-minute examination. This is considered positive. Okay. Normal amniotic fluid take in the score 2. Breathing movement take 2 in the score. Then body movement should be 3 or more body movement. If it is positive, 3 or more movement, it takes in the score 2. Then the fetal limb movement, extension and deflection, denoting the limb extension and deflection, denoting the fetal tone. So as you see, fetal respiration, at least 1. Fetal body movement, 3 or more. Fetal extension and deflection. So all these are the 3 items, taking, if positive, taking 2 in the score, each one. And the amniotic fluid, if it is normal, taking 2. So this is 8 point up till now, and another 2 for non-stress test. So the total number of the score is 10. Okay. Let us go to the detail. So what is the biophysical profile? It is a maximum 30-minute long ultrasound assessment to assess fetal well-being, coupled with fetal heart rate tracing. So what is the modified biophysical profile? The modified biophysical profile is a shortened study that involves a non-stress test and the amniotic fluid index. So summarized, the biophysical profile becomes summarized in the modified one to be only 2 items: non-stress test and the amniotic fluid index evaluation. Okay. So this is the items of biophysical profile, as I mentioned before, non-stress test, assessment of fluid index, fetal breathing movement, total body movement, limb tone. What is the technique? The patient positioned in supine position, and we are going to use the curvy linear probe with depth ranging from 10 to 15 centimeter for most patients. The probe should be held in the sagittal plane and parallel to the bed, taking care not to angle the probe, cephalad or caudal. Measurements are taken in the vertical plane in a pocket of fluid that doesn't contain limbs or umbilical cord. So when you take the pocket you are going to measure shouldn't contain any limbs or umbilical cord, just the amniotic fluid. What is the recommendation of the American College of Obstetrician and the Gynecologist? Which is better, single pocket or amniotic fluid index? They prefer the single deepest pocket measurement. Okay? For the fetal movement assessment, the probe will need to be angled to capture a window that clearly show the target anatomy. As I said before, the duration of the test is 30 minutes. We will evaluate the fetal breathing movements, total body movement, and the limb tone demonstrated by flexion and extension of the limbs. The presence of fetal distress, acidosis, hypoxia, and asphyxia, the fetal breathing movement are lost first, followed by body movement. Then extremity tone. So these findings should reflect in the fetal heart rate as decreased variability and the absent acceleration. What is the non-stress test portion of the biophysical profile? The non-stress test portion uses standard fetal heart rate monitoring to evaluate at least 2 accelerations of at minimum 15 beat or more for at least 15 seconds in a 30 minutes interval for gestational age greater than 32 weeks. Which gestational age I can use biophysical profile? It is recommended to start at 32 weeks gestation for most fetal and maternal conditions. If there are multiple or severe conditions, antenatal testing can begin earlier. What is the indication of using biophysical profile? As a whole, if I did the non-stress test and it was non-reactive, this is one indication. Another indication, decreased fetal movement. The woman complain of decreased fetal movement. The third big indication is maternal diseases or pregnancy-related complication, as in high-risk pregnancy. So it could include maternal diseases like diabetes with pregnancy, hypertension, systemic lupus, chronic renal disease, antiphospholipid syndrome, thyroid dysfunction, sickle cell anemia, and thalassemia, cyanotic heart disease, or pregnancy-related complication like preeclampsia, decreased fetal movement, gestational diabetes, oligohydramnios, fetal growth restriction, isoimmunization, previous history of fetal demise, monochorionic multiple gestation. So please look to this table to know what is normal biophysical profile test. Okay, this is the 5 items. Non-stress test should be reactive if 2 fetal heart rate acceleration in response to movement within 20 minutes, amniotic fluid volume, a single deepest vertical pocket of amniotic fluid greater than 2 cm and less than 8 cm, fetal breathing movement, 1 or more rhythmic breathing episodes of 30 seconds or more, fetal movement, 3 or more fetal gross body movement, separate movement of the body or limbs, fetal muscle tone, 1 or more opening or closing of the hands and the mouth, extension and deflection of the limbs. Extension and deflection of the limbs. Let us go to the diagnosis. After we did biophysical profile, we have a score. If the score from 8 to 10, either 8 or 10, this is normal, and provide reassurance that the risk of fetal asphyxia within 1 week is extremely low. What if the score is 6? This is considered either equivocal or abnormal. But you should notice, if oligohydramnios is diagnosed, the study should be repeated in 24 hours, or the patient should possibly be induced if at term. If the patient has a score 6 and there is oligohydramnios and she is full term, you can do induction. If she is not full term, you should repeat the test within 24 hours. If all points off relate to fetal movement, I mean the amniotic fluid is okay, the non-stress test is okay, but all the point off related to fetal movement, and the score is 6. This is more reassuring, but the study should be repeated in a short interval. Okay? Okay. What if the score is 2 or 4? This is not reassuring, and the recommendation is to either move toward labor induction or cesarean section depending on what is the most prudent. Okay? What if the score is 0, indicating impending fetal asphyxia, and delivery should be urgent cesarean section at hospital with neonatal ICU capability. Let us go to the next item in antenatal fetal well-being test, the fetal growth. Now we finished the non-stress test, the biophysical profile, and the third one now is fetal growth. How to know fetal growth? How to know the baby is growing well? First, you should know the gestational age, and the date should be accurate. How? By the last menstrual period calculation of the expected gestational age, and by ultrasound early in pregnancy to measure the gestational sac diameter, as in this picture, the mean sac diameter, and the crown rump length. Crown rump length. Please remember to exclude the yolk sac from measurement. It's not measured. Okay. Crown rump length is the most accurate ultrasound test to measure the gestational age and they give the expected date. Okay. Okay. So The plus or minus during early pregnancy with crown lump about 5 to 7, while the fetal biometry is about 7 to 10 during mid-trimester as regard the biparietal diameter, the femur length, while in third trimester it is plus or minus 3 to 4 weeks, so it is not accurate in the last trimester. The earlier, the better, and the best is the crown rump length. Look to this picture. This is the biparietal diameter, as you see here. This is the occipitofrontal diameter, and this is the head circumference in white. Okay. This is the abdominal circumference, and this is very important because it is one important item in the formula for measuring the expected fetal weight. And if the abdominal circumference decreased, this means fetal growth restriction. So we are going to use the ultrasound to measure the fetal biometry. So, as I said, we will start with accurate dating, then fetal biometric measurements. The standard fetal biometric measurements are biparietal diameter, head circumference, abdominal circumference, and the femur length. Expected fetal weight formula are heavily weighted towards the abdominal circumference, and the small abdominal circumference is a strong predictor for fetal growth restriction. Fetus is considered small for gestational age if expected fetal weight is less than 5th or 10th percentile. But you should remember that not all small for gestational age fetus are growth restricted. Why? Because small for gestational age fetus may be constitutionally small, but healthy and normal. However, the fetal growth restriction fetus is at risk for hypoxia. Okay, two pathologies related to growth restriction, the asymmetric and the symmetric growth restriction. Asymmetric growth restriction pattern is a hallmark finding in fetal growth restriction presenting in the third trimester, usually. Symmetric growth restriction is usually of early onset and often is concerning for chromosomal abnormalities. Okay? Let us go to the fourth item for fetal well-being tests, which is Doppler ultrasound. As you see in this picture, this is umbilical artery Doppler and umbilical vein. So, as you see, these waves, the peak of systolic volume and the end diastolic volume. This is for umbilical artery. The venous is down. Okay. As you see in the other picture on the right side, this is the abnormal. On the left side, this is the normal. On the right side here, you can see the absent end diastolic flow. There is no end diastolic flow here. This part is not present, as you see here. Absent end diastolic flow. And in the other picture, maximum to the right, there is reversed flow in the umbilical artery. There is reversed flow in the umbilical artery. This is a dangerous sign. Okay? So, Doppler ultrasound is used to detect the fetal placental circulation, which is essential for evaluating the fetal well-being. The umbilical artery, middle cerebral artery of the fetus, uterine artery, ductus venosus, and the umbilical vein are commonly investigated visits. What is the aim of using Doppler? The Doppler enabled the non-invasive detection of signs of placental insufficiency and of fetal hemodynamic changes. Also, Doppler velocimetry enables the differential diagnosis between fetuses that are deficient in nutrients or have hypoxia and require intensive management, and those that are constitutionally small. So I can use Doppler to differentiate. I have two cases with a small for gestational age fetus. One could be constitutional and the other could be pathologic due to placental dysfunction and the hypoxia. Okay? Doppler can help me to differentiate between both. What about the normal Doppler velocimetry? Umbilical artery flow is low resistive with decreasing systolic diastolic ratio with advancing gestational age. The middle cerebral artery has relatively less diastolic flow than the umbilical artery. The ductus venosus waveform is distinctive with systolic, diastolic, and atrial contraction waves. The umbilical venous flow is uniform and may demonstrate fetal respiratory variation. Uterine artery flow is low resistive after 24 weeks. What if we are in a setting of hypoxemia or poor placentation? What do you expect from Doppler? Doppler wave form abnormalities may predate changes in amniotic fluid volume and the growth of the baby. Okay? Absent or reversed diastolic flow in the umbilical artery reflects placental vascular dysfunction. As I mentioned before in the picture at the start. Compensatory increase cardiac output to the fetal brain result in increased middle cerebral artery diastolic flow. This is a compensatory mechanism. When there is decreased blood flow to the baby, the fetal circulation accommodate this by increasing the blood flow to the brain. Okay? So that's why there is increased middle cerebral artery diastolic flow. In the ductus venosus, reversed A wave flow reflects right heart stress with venous flow reversal during atrial contraction. What about uterine artery? Uterine artery shows increased resistive flow and post-systolic notch, reflecting increase in spiral artery flow resistance. What about the umbilical artery? There is notched systolic flow, as in this picture. This is the notch, this is the notch, this is the notch, this is notched systolic flow in umbilical artery. Let us go to the last item for fetal well-being test, the fetal movement count. If you remember now, we covered the non-stress test, we covered the biophysical profile, the fetal growth evaluation, Doppler velocimetry during pregnancy, and lastly, the fetal movement count. Fetal movement count, first of all, you should know that the first perception of the fetal movement is called quickening, and it is starting from 16 to 22 weeks. And it is more earlier in multiparous than primary gravity. because multiparous has an experience. She can feel the fetal movement earlier, between 16 to 18 weeks, while the primigravida can feel it mostly or usually between 18 to 20 or 22. What is the importance of the fetal movement? Fetal movement felt by pregnant women are a sign that the fetus is growing in size and strength. And many obstetricians and researchers find that fetal movement changes throughout pregnancy can indicate normal or abnormal development. What about a kick count? It is recommended that pregnant women monitor fetal movement, especially by the third trimester. So during antenatal care, you should counsel the patient to monitor the fetal kick. And you can give her a chart like this one. This is the days in the week. She can count and write the number of kicks. Clinicians often recommend starting this surveillance around 28 weeks gestation and continuing throughout the remainder of the pregnancy. What about the count to 10 method? The count to 10 method, you ask the woman to count the fetal movement at the same time each day. If the woman experiences less than 10 movement in 2 to 3 hour period, she is instructed to contact her health care provider. So we finish now the 5 items in the antenatal fetal well-being test: the non-stress test, the biophysical profile, the fetal growth, the Doppler velocimetry for umbilical artery, uterine artery, middle cerebral artery, ductus venosus, umbilical veins, and lastly, the fetal movement. And this is the end of my lecture. Please remember my site as an author on Amazon with these 4 published books: textbook of obstetrics, textbook of gynecology, contraception handbook, and the multiple choice question. You can visit the site and see sample of this book, and you can get it through Amazon. Thank you.